My name is Heather Meador, and for my final project, I'm going to be discussing Hashimoto's disease. First, we'll take a look at what is Hashimoto's disease. Hashimoto's disease is also known as Hashimoto's thyroiditis. Hashimoto's disease is an autoimmune disease. This disease is a condition in which your immune system attacks your thyroid. Over time, the disease will slowly kill the thyroid. This is hard to diagnose because the signs and symptoms are like those in many other diseases. Hashimoto's disease is the most common cause of hypothyroidism. Now we will take a look at some risk factors associated with Hashimoto's disease. Some lifestyle risk factors are the fact that Hashimoto's disease primarily affects more women than men. Your chances of developing this disease increase with your age. When estrogen levels decrease when women go through menopause, it may affect your thyroid function. Genetics also play a role. Relatives of people with Hashimoto's disease have an increased chance of developing the disease themselves. Having another autoimmune disease also increases your chances. Some environmental risk factors are bacterial infections. The disease may be triggered by a number of fungal bacterial infections that start in the gastrointestinal tract. Excessive iodine tends to trigger this disease as well as other types of thyroid diseases. Research has also found that there is a link in people who have been exposed to radiation for cancer treatments and Hashimoto's disease. Some signs and symptoms of Hashimoto's disease may include rough, dry skin, hair loss or hair dryness, constipation, depression, fatigue and sluggishness, an unexplained weight gain, excessive or prolonged menstrual bleeding, enlargement of the tongue, memory lapses, an increased sensitivity to cold, brittle nails, or joint pain and stiffness. Some treatments for Hashimoto's disease. Not all people who are diagnosed with the disease develop hypothyroidism, so your doctor may just monitor your symptoms. If hypothyroidism develops, the usual treatment is a synthetic form of thyroid hormone, which is called levothyroxine, which restores the normal function of your thyroid. Hashimoto's disease itself is not fatal, but if left untreated, you could develop other serious complications. Those complications may include heart failure, mental health issues, myxedema coma, which is a rare, life-threatening condition which can lead to heart failure, seizures, coma, and sometimes death. A thyroidectomy is not necessary with this disease because it is normally managed with medications. When it comes to diagnosing Hashimoto's disease, it is diagnosed by blood tests that measure the level of thyroid hormone and thyroid-stimulating hormone produced in the pituitary gland. These tests may include a hormone test and/or an antibody test, due to this being an autoimmune disease. There is no way to prevent developing Hashimoto's disease, but there are currently clinical trials going on to see if diet, smoking, and alcohol intake increase your risk of developing the disease. If you are diagnosed with Hashimoto's and it develops into hypothyroidism, some lifestyle modifications may help with managing the disease. Diet, exercise, and some supplements may improve your symptoms and your quality of life. If you are diagnosed with this disease, rest assured in knowing that it is manageable and can be treated with medications. As always, make sure you talk to your doctor before taking any supplements. This is my works cited page. This shows you all of the websites that I used to gather my information for my project. You will likely see some familiar names on here. I did get information from the Mayo Clinic, Medline Plus, Very Well Health, as well as WebMD. Thank you so much for taking the time to listen to my presentation.